Marijuana is one of the most popular drugs used worldwide. But did you know that smoking marijuana has many harmful effects on the human body and ultimately leads to lung cancer? Over 70% of marijuana users choose to smoke marijuana, which leads to many health risks such as cancer and lung disease. In this PSA, we will be addressing the history of both medical and recreational marijuana, how it affects your body, the smoking crisis, as well as offering solutions to allow people to reap the benefits of marijuana while limiting the problems to the human body.
Cannabis was first used in Central and South Asia for ropes and fabrics, but it is believed that it was not used for its psychological properties until later. There are some theories about its uses in ancient Indian drugs, but they are often disputed because there is a lack of evidence. Throughout the 1800s, Great Britain began to outlaw marijuana in their own country as well as their colonies, many due to concern with its effects on their labor workers. By 1906, the United States outlawed it as well, later passing the Marijuana Tax Act prohibiting any hemp production. Importing any kind of cannabis was only legal if it was for scientific or medical purposes. The first instance of legal tolerance of marijuana was in the Netherlands in coffee shops. Uruguay was the first country to fully legalize marijuana for recreational use in 2013. Countries that have legalized marijuana today are Czech Republic, Colombia, Ecuador, Mexico, Portugal, and Canada. States in the United States have legalized it, however, it is still federally outlawed. This is a map of the varying legality of marijuana in the United States. Smoking? People can either smoke out of a joint, blunt, pipe, or bong, and all forms of smoking are damaging to the lungs and the immune system. As mentioned before, it is the most popular method of consumption with 71.1% of users smoking. Vaping is a smokeless form of consuming marijuana, which works by heating some form of cannabis extract to the point of vaporization. The high temperature separates the chemicals, allowing vapor to form. Edibles are a fairly popular way to consume marijuana due to its stronger effects. This method is more potent due to a chemical reaction within the liver that turns the THC into 11-hydroxy-THC, a far more potent chemical. However, the downside to this method is by creating edibles, one's kitchen will end up smelling like marijuana, so it is often a less desired method of consumption. While not a largely popular method of consuming marijuana, works by heating up cannabis concentrate to the point of combustion, allowing the THC to be released into the air. This small amount of THC is surprisingly potent, containing up to 80% THC and providing an effective way of consuming large amounts of marijuana.
Marijuana interacts with your body through its main chemical component, THC. THC reacts with both the brain and the blood in the human body to create the numbing effect of cannabis. The cannabinoids in the THC attach to receptors in your brain that control and restrict movement, memory, and vomiting. It is also absorbed into the bloodstream and distributed to the whole body, then blocking off pain and movement receptors all over the body for a shorter amount of time. Because of these reactions, marijuana can also affect reaction time and hand-eye coordination. Both medical and recreational marijuana both have many benefits that support the idea of legalization. A 2003 study found that marijuana can help control epileptic seizures by calming nerves and bonding brain cells together. Marijuana also helps control the spread of cancer by blocking off the ID1 gene, making it a suitable solution to chemotherapy. It also helps cancer patients post-chemo. As explained earlier, THC helps prevent vomiting in users, which is a common side effect of chemotherapy. Marijuana is also very helpful for dogs who suffer from anxiety. The THC works in dogs the same way it works with humans and helps calm them down. Marijuana, or puppy pot, is sold in states with legalized recreational marijuana in treats under the name treatables.
Chemical solution to the issue of unhealthy methods of consumption of marijuana is to consume it through oil diffusers. There are many types of oil diffusers, however, each process has different effects on the potency of the properties of each oil. Both evaporation diffusers and diffusers that use heating can change the properties of the oil. Two other kinds of oil diffusers are ultrasonic and nebulizing. Ultrasonic diffusers are typically the most popular oil diffusers. After adding water and oil to the diffuser, it begins emitting an electric current to cause vibrations that spread the oil particles throughout the air. Because there are only physical changes to the oil, it causes a phase change rather than a chemical change, so it does not alter the oil's properties. Nebulizing oil diffusers provide the same outcome, but these diffusers use pressure and a vacuum, causing the oil to atomize, releasing oil particles into the air. Both methods of diffusing do not dilute the oil's properties, but also release them into a larger space. This is relatively ideal for people using marijuana because it is potent, cost-efficient, and has no negative health effects. Cost efficiency can play a role if more than one person is consuming marijuana from an oil diffuser because the chemicals are released into the whole room. Additionally, consuming marijuana through an oil diffuser would be very easy to do, and it has no negative side effects on human health.